I hear from a lot of people who have frustration about, do they have a hiatal hernia or don't they? And I certainly understand the frustration, because what happens is that they'll get an endoscopy and they're told they don't have one. They'll get another and they're told they do, or vice versa. And then the question is, well, they found it before and they didn't find it now, so I guess it just healed spontaneously on its own. So let's dive into what the problems are with that, and I want to kind of redirect you to where your focus should be, in my opinion. So first of all, most hiatal hernias are small. 95% of them are sliding, meaning they go up, they push, the stomach pushes above the diaphragm, and then it comes back down. So during an endoscopy, the other statistic that's important to know is that they're caught 40 to 50%, sorry, the opposite. They are missed 40 to 50% of the time. So you can have an endoscopy and it catches it, and you can have another endoscopy and it doesn't, because they're missed almost half the time, 40 to 50% of the time. So it didn't mean that it's spontaneously healed and that it's not there anymore, they just missed it. So what happens during an endoscopy, one of the problems is that, of course, the sliding part, 95% of them sliding. So it's down, it's not up, but also you're under anesthesia during an endoscopy, and the sphincter of the lower esophagus, the sphincter muscles relax because you're basically unconscious. And so even if it was up a little bit, it can slip down because everything kind of relaxes. So that's part of the problem. And most people don't want to do it without anesthesia, because there's a lot of choking sensation, gagging sensation, and if you're anxious, definitely not something for you to go through. So it's not necessarily a good fit for somebody to not use anesthesia, although they do, the percentage improves when you're not under anesthesia. But here's what I think is most important to focus on, is you and how you feel and what your body is telling you. And if you go through an endoscopy, even if they don't find a hiatal hernia, what did they find? Because what the endoscopy is good at is finding what's happened to your esophagus, the lining of your esophagus. Do you have esophagitis, inflammation of the lining because of acid reflux? Do you have gastritis in your stomach? Do you have Barrett's esophagus, which means you've probably had acid reflux going on for quite some time, and now we're getting cellular changes that can turn into a precancerous, cancerous situation. That's what we should focus on from the result of the endoscopy, is what did they find that was abnormal, and even more importantly, getting back to you. What are your symptoms? How do you feel? Do you feel acid reflux yourself? Do you have gas? Do you have bloating? Do you sometimes have trouble swallowing? Do you ever have regurgitation of your food? Do you get heart palpitations? Do you have shortness of breath? Do you have anxiety? Do you have lightheadedness or dizziness? What else was on my list? That was it. Oh, hoarseness is another, and that's a symptom of silent reflux, which is affecting more at the top of the vocal cords, the area of your larynx and pharynx. So that's called LPR. I recently did a video on that, because that's another thing that's missed, because the acid reflux, the classic symptoms of reflux, tasting acid, feeling the burning in your chest, hence the name heartburn, that's not occurring with silent reflux. Instead, the acid is coming up and it then resides at the top, as I said, into your voice box and the back of your throat. And the symptoms more have to do with feeling like you have a sore throat, feeling like you have postnasal drip, clearing of your throat, having a cough. So different symptoms. But on the topic of symptoms, how do you feel? Do you have digestive complaints? Again, also heart, shortness of breath. What's happening? And if you have the classic symptoms associated with hiatal hernia, because I've been getting a lot of comments recently, and I really try to respond to pretty much every comment I get, and there's been a lot of that input coming from you all, that it's like, I have every symptom that you're talking about, but I'm told I don't have a hiatal hernia. That doesn't necessarily mean that. Well, what does that mean? It means you have to pursue why you have the symptoms, you see, because your body's saying, I'm functioning abnormally, I'm struggling here. And what's absolutely true is that if you do not have a healthy gut, a healthy digestive system, it is truly impossible for you to be truly optimally healthy. The two are incongruous. You need to have a healthy gut in order for so many other parts of the body to work. I mean, think of it from the very basic of, your gut turns food into fuel and fuels your, several trillion, 10 trillion cells in your body. So if you're not fueling a cell, how is it going to function? So you can keep it really simple and not go into many of the other topics that we talk about. But we have to have a healthy gut. So if you have these symptoms, I don't care if they can't find a hiatal hernia. That's not the point. The point is we have malfunction, and we need to restore optimal function to your gut, knowing that with having this whole constellation of symptoms, it's very likely that your heart palpitations, your shortness of breath, and your anxiety are coming secondary to the gut issues. And then we come at it from all the ways that we do to say, how did you get here? Versus how somebody who has the exact same symptoms, how they got there. And if you're new to this channel, the programs that we offer are very personalized. They're completely customized to each patient because we are all unique. That doesn't mean there aren't common threads, because there are. There's a lot of common threads that we see, from diet to lifestyle to what's called dysbiosis, meaning imbalance of the bacteria in your colon, signs of inflammation, sources of inflammation, because it's the inflammation that tends to create the pressure on the stomach. So those are all the things we look at, and we tease it out and we see what's true for you. How did you get here, and how do we undo it? So I really wanted to address this because suddenly there's been a lot of influx of these questions, and they're very good questions, because you can be confused because you just think it's what's most important is the diagnosis. Do I have it? Do I not have it? Do I have it? Do I not have it? And the tool that's being used, the endoscopy, is not an accurate tool. It misses it 40 to 50% of the time, and most people don't know that. So what's more accurate, as I said, is what has the endoscopy found, in your esophagus and in your stomach, and then what are your symptoms? What is your body saying to you? And that's the most important thing, because that's your body's communication that things are not the way they should be. And it doesn't matter what the name of it is, a rose by any other name, as Shakespeare said. But the important thing is that malfunction is there, and how do we correct it? That's ultimately the most important thing. It doesn't matter what the label is. So I hope that makes sense, and we are here for you. That's what we do. We're specialists in this area. And by the way, if you enjoy this channel, please consider subscribing. We definitely want more people to be able to see this information, because a lot of people are suffering with hiatal hernia. A lot of people are suffering with gastrointestinal complaints, and they're not getting answers because the traditional conventional medical system is all about that. What's the label, and what's the drug that manages that label, right? That syndrome, that disease. And there's so much more that can be done to really get to the root cause and heal you properly, so you don't continue to have these problems. So if you like the video, give it a thumbs up, subscribe, and I'll talk to you soon.